10th. Wow. Whichever.
And we are live, Senators.
All right, good morning. Jen, can you touch the screen up there? Yes. Okay. Good morning. It is May 10th, and this is Senate Health and Welfare Committee meeting. We're meeting for a very short period of time to go through a proposed amendment that Senator Cummings has on today's calendar. And Senator Cummings is unable to be here to present her amendment, so we've asked Ledge Council to go through it with us so we understand what is included. So thank you for being here.
Sure.
Jen.
Good morning, Jennifer Kirby, Legislative Council. So yes, we are looking at the amendment proposed by Senator Cummings. It is on the committee page, and it is also printed in today's Senate calendar. This amendment, sort of the broad concept would be, it would keep in section 4 just the brown bagging, white bagging language. So the language saying that the insurers or PBMs cannot require a pharmacy that they designate to either dispense medication directly to the patient with the expectation that the patient would bring it to the provider's office to be administered there, or directly to the provider for to be administered to the patient there. So that's kind of what has been referred to as brown bagging and white bagging. That would remain in section 4. Everything else from section 4 of the bill as you passed it out of this committee, so all of those other provisions about kind of the specialty idea of specialty pharmacies would move to section 5, the study. So the study would get bigger, and I also split it into 2 pieces. So because there is so much in that study, it would have DFR provide an update on its findings and recommendations in January of 2023, and then its final findings and recommendations by January 2024.
So as we were looking at this, there are some things that we already have in the study, and then there are things that are being added into it.
Exactly.
Okay.
Exactly. So this adds on to the study that was already in the bill. It added, I mean,
yeah.
Generally the idea is that it moved many of those provisions into it from your section 4. So about the health insurer PBM has to permit a participating network pharmacy to perform all pharmacy services within the lawful scope of the profession of pharmacy. That would come out. That was kind of
Which number is that? That's number 4
in the amendment.
Yeah,
That's number 5.
number 5. Okay.
Mark, so I put it in there right.
So it's
right
number
after
5 is added.
So number 5 is added, and then numbers 9 and 10.
So what it does is it gives the PBMs the authority to determine the scope of practice for the pharmacist.
Well, it doesn't change anything about current law as it relates to the definition of the scope of practice. So it would not prohibit the kinds of limitations I think you're talking about that have been done through the network participation contracts with the pharmacists and pharmacies. So there's nothing in here that affirmatively authorizes that practice to occur, but we have heard testimony that it is occurring. This bill would not prevent it from continuing to occur. It would just have that be part of what gets looked at in the study.
And number 9.
Number 9 is trying to take that concept in subsection B of, if you happen to be looking at the bill, it was on page 18 of at least this committee's strike all amendment, building on that existing idea of retail pharmacists being able to fill prescriptions in the same manner and at the same level of reimbursement as they're filled by mail order pharmacies with respect to quantity of drugs for day supply dispensed. We kind of expanded that a bit in the bill, partly by specifying that if we're talking about all prescription drugs, and you had that definition of prescription drugs that specifically included the so-called specialty drugs, and also expanded the scope beyond mail order pharmacies to include any other pharmacy, and specifically calling out pharmacy benefit manager affiliates.
And so she's just moving that into a study.
So, right, so that became number 9 in the study. And then number 10 is all of those provisions of what had ultimately became D2, but had been D3. That was the DFR recommendations for how to rewrite some of what came over from the House. Prohibiting health insurers and PBMs. In your bill, it prohibits health insurers and PBMs from requiring a covered individual to purchase their pharmacist services, including prescription drugs, exclusively through mail order or a PBM affiliate, offering or implementing plan designs that require them to use a mail order pharmacy or PBM affiliate, ordering them to do so, ordering the covered person to do so through online messaging or otherwise orally in writing to use a mail order pharmacy or PBM affiliate, establishing network requirements that are more restrictive than or inconsistent with state or federal law for the Board of Pharmacy's rules, or guidance from the Board of Pharmacy or drug manufacturers that operate to limit or prohibit a pharmacy or pharmacist from dispensing or prescribing drugs, or offering or implementing plan designs that increase the patient's costs if they choose not to use a mail order pharmacy or PBM affiliate, including requiring them to pay out of pocket.
So if they can't require it, but they can always recommend it. There's nothing that says they can't recommend it.
Right, they can recommend, but they can't require it, and they can't structure the plan in such a way that it creates financial incentives. So all of that in the amendment moves over to the study.
Bill is an action. I mean, that's.
Yeah.
Yeah, we're already
Right, so you-
allowing that anyway.
So in your bill, you said you can't do that anymore.
Can't
In the amendment,
Can't
I
require.
would say, let's stop and look at it first and come back with
And
recommendations.
it's hard to study it if you don't know what's going on. So, because the contracts are not transparent, so makes it catch-22. So what is number 10 then? Because number 10 is also one that she.
Number 10 is the one that I just went through from the bill.
Okay.
So instead of saying in your bill,
Right,
it says they
okay.
can't do it, this says, look at whether they should be prohibited
Right,
from doing one or more of those things.
okay. Okay. Questions of Jen on the proposal? This is like deja vu all over again for us, but. And Senator Hardy was here and she already spoke against the amendment and supported the underlying bill, so you know that.
As do I.
Okay,
I support the bill and I think we should say no thank you to the amendment and full steam ahead on the bill.
okay,
As well.
as well. Okay, so there's 4-0, 4-1, probably 2 would support it. The committee does not recommend that we support this proposal of amendment. Thank you very much for coming
Welcome.
in. Alex, I think we can go offline. I think that does it for us